listening to it. This is going to be a little different than I think the other presentations in the symposium, in that it's maybe more general and less focused on wildlife and aquatic species, and more general discussion of how the nervous system reacts to neurotoxicants. Certainly in mammalian and avian wildlife pathology, neurotoxicology occurs on occasion. I must confess I don't know enough about fish and other aquatic animal pathology to know whether that's a real problem, and possibly someone could educate me about that if indeed it is a problem. In talking about the nervous system and particularly the effect of toxicants on the nervous system, one I think needs to go back and review some basic cell biology and neuroanatomy as to how the nervous system functions. And then classically, neurotoxicologists have taken compounds affecting various segments of the nerve cell or the myelin sheath or other glial elements and demonstrated how those affect those cells and then how they produce the lesions and clinical effects of the intoxication. So I'll spend the first part of my talk basically reviewing some of the more up-to-date aspects of the understanding of the nervous system. And then for those of you, this may be the nature of a review, I apologize if this is old hat to you. I'm sorry, thanks, Tom. Is that better? Yeah, thank you. So if I could have the first slide done. Let's see. The nervous tissue is, of course, divided into the brain and spinal cord as a central nervous system and the peripheral nervous system. And the cells making up these areas of the nervous system are, of course, the neuron, the major functional cell, which has a cell body, which is the site of most macromolecular synthesis. Dendrites, which are extensions of the nerve cell body, and provide a place for synaptic input from fibers approaching this particular cell. And lastly, the axon, which sends messages to elements which this particular cell to which this cell is communicating, and that does that by synapses. Then the glial elements include astrocytes, which are sort of the supporting cell of the nervous system. In disease states, these become quite important, and one can analogize them to the fibroblast outside the nervous system in some fashion. They also do play a role in some intoxications, such as ammonia intoxication, where the primary detoxifying site of ammonia in the nervous system is in the astrocyte. The oligodendrocytes form the myelin sheaths in the central nervous system, and the Schwann cell has the same role in the peripheral nervous system. These are anatomically a bit different, and the myelin is not exactly the same as well. Then lastly, ependymal cells line the ventricle, and relative to the ependymal cells lines the choroid plexus, and is a site of production of cerebrospinal fluid. There is a macrophage source, sort of an in situ macrophage precursor, the microglial cell, in the central nervous system. This cell is a mesodermal derivative, but which arrives in the developing nervous system during embryogenesis and remains there, and can give rise to macrophages, which also can give rise, as in any other tissue, from circulating blood monocytes. Myelin is a sort of special insulation formed by, as we mentioned earlier, the Schwann cell or oligodendrocytes, forming segments along some of the larger axons, and then basically being a product of these cells. Of course, the blood vessels with the blood-nerve barrier, blood-brain barrier. And lastly, the coverings or meninges. And I'll briefly show some of the aspects of these elements, and then get into the toxicology. The neuron, as I mentioned, is made up of the cell body or soma, the dendrites, and the axon. I obviously need an extra hand here.
Can I focus that one?
Yeah, if you don't mind. Thank you. But you'll have to advance it for me with that as well. And this is the, yeah, if we could just go back one, please. schematic view of the sort of a cartoon, if you would, of one of the larger neurons with the cell body here. Again, as I mentioned, this is where most of the protein synthesis occurs. Some of it occurs in the dendrites as well, but the pericardial cytoplasm is the major site for this process. And then the dendrites providing a rather expansive area which afferent fibers, axons coming toward this cell, on which they can synapse, as well as they also synapse on the cell body, basically providing informational input to this particular cell. And then lastly, the axon, which the artist has drawn in this convoluted fashion, which clearly doesn't occur in nature, but just to demonstrate the length of this particular process. And this is a specialized process which conducts electrical impulses. In this case, they've shown this as a myelinated fiber, that is the myelin being formed in segments with the node of Ranvier between each segment of myelin. And of course, these are much more rapidly conducting fibers. There also are unmyelinated fibers, and indeed most of the fibers are unmyelinated, which are much smaller. And then lastly, the termination of the axon giving rise to synapses connecting target cell. Next, please. Just look, structurally, this is a plastic section. I should add that for most neurocritical light microscopy now, plastic embedding is the way to go, if you would. It certainly gives you, as you can see here, a much more clearer picture of the cell. This is a cell body. The nucleus is out of the plane of section. We have these stacks of rough endoplasmic reticulum, which look like little purple dots, clumps, which are the Nissl substance, and one of the sites of protein synthesis. And here are two dendrites being shown in the photograph. And next, please. Just to review some of the organization of this cell again, we have the cell body, and you can see that in some cases the cell body may be in the central nervous system. Here's a lower motor neuron, and the axon, which I'm going to discuss in a moment, resides partially in the central nervous system and partially in the peripheral nervous system. Alternatively, the cell body may reside in the peripheral nervous system, as in this dorsal root ganglion cell. This is the spinal or dorsal root or sensory ganglion. And in this case, these cells have a single process, an axon, which divides and has a central branch which may synapse as soon as it enters the spinal cord, or may be carried up in the fasciculus gracilis to synapse in the medulla. And also has a peripheral process which goes to a sensory ending. And of course, these may be myelinated or unmyelinated again. Next, please. Now look at some of the axonal structures. This is the cell body, in this case with the nucleus, prominent nucleolus. And here we see the axon hillock, where the axon, from which the axon arises. The initial segment of the axon is unmyelinated, in myelinated fibers. And then at this point you can see the first internode of myelin in the plane of section, and then these are repeated down through the extent of the axon. And the axon may be from 100 to 1,000, about 100 to 1,000 times as much cytoplasm may be in the axon as there is in the pericardium. So the axon in a large neuron can really be a substantial component of the cell. And since there is no protein synthesis, materials must be synthesized in the cell body and carried down to the axon. And in many of the disease states, the toxic states, there's interference with this transport to lead to degenerative states in the axon. Again, just a cross-section of a small branch of a peripheral nerve showing the myelinated. With this stain, the axons are very pale. The myelin sheath is this deep blue material. And you can see the relative size of the myelinated fibers. And the unmyelinated fibers are these tiny pale dots, just to give you a comparison of the relationship of size of the myelinated to unmyelinated fibers, the unmyelinated ones being quite small. And an electron micrograph of a myelinated fiber, which shows in this case, the prominent neurotubules. And there's also, not strikingly visible here, there's a rich component of neurofilaments as well, the intermediate filaments. One can tease the axon in the peripheral nerve and to sort of look at it in, if you would, 3 dimensions. And in this case, we've got one that's sort of lined up going in this direction. And it does show, in this case, the myelinated segments. Here's a node of Ranvier, here's another node. This would then be the internode of myelin formed by the Schwann cell. The nucleus of the Schwann cell is roughly here. And here's the next internode and so forth. And you note the distance, the length of these internodes is fairly consistent. And that's typical of the peripheral nerve myelin, actually the central nervous system myelin as well. Mentioned the endings of the axon. In this case, here's a cell body, and here are two synapses, rather specialized endings containing synaptic vesicles with neurotransmitters which are discharged across this little gap and affect the postsynaptic membrane and can lead to initiation of action potentials in the postsynaptic element. As I mentioned, the axon, when you look at the organization of the axon, it can be quite extensive in large neurons. The cytoskeleton contains neurofilaments, three molecular weights, light, L, M medium, and H heavy. And it's the last two, the medium and heavy neurofilaments, which may be phosphorylated. And there are also neurotubules. And this forms, as I see, the cytoskeleton. As I mentioned earlier, there's a lack of ribosomes in the axon and therefore a lack of protein synthesis, and therefore this long process is dependent on axonal transport. And this has been rather avidly studied, extensively studied, and at this point there seems to be two components, the so-called fast transport, which is between 100 and 400 millimeters a day, which is bidirectional. That is, it can go from the cell body distally, or it can go from the distal end of the axon back to the cell body. And it does carry neurotransmitter polypeptides, membrane-associated molecules. So a lot of the membrane structural elements are carried by the fast axonal transport. And in addition, endocytosed materials taken up by the distal axon and carried back to, in a sense, inform the cell body of the environment of the axon terminal. Then there's the slow component, which is primarily cytoskeletal elements and has two components, slow component A, which is primarily neurofilaments, and slow component B, which contain actin and tubulin. And as I mentioned before, again, interruption in axonal transport is rather critical in some forms of neurotoxic injury. And others as well. One could, if you crush the nerve, one of the things you do is interrupt. In fact, if you crush the axon, the major thing you do is interrupt axonal transport to provoke this classical Wallerian degeneration, which has been shown distal to such injury. Just a couple of words about the glial elements. The astrocytes, as I mentioned, are supporting cells, very active in injury to the nervous system, where they tend to increase in size and they go hypertrophy, as we see here. This is a case of methylmercury poisoning. It's the cerebral cortex of a dog. There are a few dark staining neurons remaining, but most of the cells we see here are actually hypertrophic astrocytes. So, and these will also become hyperplastic. There's an increase in size and number of these elements in injury to the central nervous system. Next. We'll skip that one. The microglial elements give rise to macrophages, as I mentioned, as do blood monocytes. And in a sense, these are really no different than macrophages anywhere else, although they have different names, since neuropathologists tend to do that. And sometimes these are called Gitter cells because of the amount of lipid. They become sort of large, foamy macrophages filled with lipid-rich material, and in paraffin-embedded material have this pale staining appearance because of the dissolution of the lipid during processing. But largely these are macrophages responding to necrosis and demyelination to phagocytize the injured elements. And lastly, the ependymal cells, which line the ventricular cavity. I won't say much about these. I really haven't focused on those in the neurotoxicology portion of the talk, so let's go on to the... and just a bit about the myelin. We alluded to it somewhat when we talked about axons, and it's hard to really talk about axons without talking about myelin. This is a cross-section of one of the myelinated tracts in the central nervous system, just to show that, in this case, most of these fibers are cut in cross-section. And in this light micrographic view, the ones you can see are indeed the myelinated ones. The unmyelinated ones are just too small to see. And sometimes we get some cut longitudinally as well. This is the appearance. In the central nervous system, the myelin is formed by the oligodendrocyte, one of the glial elements, such as we see here. And these cells can produce up to 50 segments of myelin each. There are numerous branches coming off. Here's the end of one branch of an oligodendrocyte giving rise to the myelin sheath around this axon. So a single cell can myelinate up to 50 internodes in the central nervous system. Next. It's a cross-section of the peripheral nerve, again, the same sort of appearance. The axons technically have stained a little deeper here. Next. And this is a Schwann cell. Here's a peripheral nerve axon with the myelin sheath formed, in this case, by the Schwann cell, which in a sense envelops the axon. And the process grows around it to form this compacted plasma membrane sheath, which is the myelin sheath. In this case, the Schwann cell forms only a single segment of myelin. So where the oligodendrocyte can form multiple segments of myelin, all apparently on different axons, the Schwann cell only forms one segment of myelin. I guess, sorry, I must have played with this a bit, but I just wanted to mention the meninges. These are sort of a cartoon of the brain tissue with neurons and astrocytes and blood vessels. And above it, we have the pia and the arachnoid, which are the two inner layers of the meninges, and the dura being the outer layer. Yeah. Likely this audience is familiar with that. So that's sort of a brief overview of the our understanding of the anatomy of this structure. And how it's some of the cell biology. Now we'll look at what features of the nervous system are pertinent to toxic injury. And the first one, as with other disease states of the nervous system, is that the neuron is postmitotic. It cannot get back into be recruited back into the cell cycle. And therefore, the animal is born with the number of neurons it's going to have throughout its life, and a loss of any neuron is basically not replaced. Clearly, there's a major functional reserve built into this system. But when loss gets excessive, then one begins to see clinical effects and pathologic effects as well. The neuron is exquisitely dependent on oxidative metabolism, and these are very large. Some of these are extremely large cells and have a rather high energy requirement. We tend not to think of neurons in that fashion, but indeed they do have a high energy requirement. We talked about the axon, and if one severs an axon, physically severs an axon in the peripheral nerve, under the appropriate conditions you get regrowth of that process, regeneration of the axon. But in the central nervous system, you don't have that. The environment is not amenable to axonal regeneration in the central nervous system, so that one could have a sublethal injury to a neuron affecting only its axon and not get repair in the CNS under those conditions. The neurons connect with each other in a very complex integrated network, and therefore a small lesion can have rather extensive clinical effects, as you might expect. So a tiny lesion, say in the motor cortex, can have rather striking effects, whereas a tiny similar sized lesion in the liver might go unnoticed. And lastly, there is some sort of protection or limitation of materials that can enter the brain or the peripheral nerve, the so-called blood-nerve or blood-brain barrier. And there are some toxic states, such as lead poisoning in the young animals, where this structure is damaged, and one gets an increase in brain fluid or brain edema. Next, please. So that if we looked at the mechanisms of neurotoxicity, and here we and certainly in terms of the effect of the neuron, there's an interference with oxidative. One of the mechanisms is interference of oxidative metabolism, sometimes associated with inhibition of protein synthesis. Sometimes this can occur independently. And these are two very important processes in the normal maintenance of the nerve cell. And clearly interference with those will produce injury. You can alter cytoskeletal production, transport, again, by alteration of axonal transport in the latter case, to produce injury. You could have with toxins that affect glia, including most of the demyelinating agents, since the myelin is a glial product. And lastly, I mentioned you may get injury to the blood vessels. Next. So in looking, for this talk, I've sort of divided the lesions that I'm going to talk about into where they affect the, which cytologic element or portion of the cell they affect. Could that be focused? Is that? Thanks. Thank you. So the so-called neuronopathies would affect the neuron, and particularly these will affect the cell body, the perikaryon and nucleus. Methylmercury is a good example. I'll talk about doxorubicin or adriamycin, which is an anti-cancer drug, which provides a nice model for this. Excess of vitamin B6 or pyridoxine can do it, carbon monoxide, affecting oxidative metabolism, aluminum, and some of the excitotoxins. And so I'll pick a couple of models to talk about neuronopathies to demonstrate the lesions associated with those. Then you could have agents that relatively spare the cell body but affect the axon, and these may affect these proximally, such as IDPN toxicity, which I'll briefly mention. Or more commonly, the so-called distal, or sometimes called the dying back axonopathy. That is, it affects actually the most sensitive part of the axon, the area most distant from the production of protein and macromolecular synthesis would be affected by these, such as organophosphates, the hexacarbons, bromophenylacetylurea, or acrylamide. Again, these are certainly the organophosphates and hexacarbons are important industrial agents, but some of the others are, as it was acrylamide, I guess still acrylamide still is, but these are now used as experimental models. And then thirdly, I'll talk about some agents that affect the myelin itself and tend to spare the axon and the cell body. Triethyl, tin, cuprazone, lead, tellurium is a model I'll talk about as well. And hexachlorophene, which has a similar reaction to triethyl tin. So one can sort of carve out little areas of susceptibility within the nervous system and see how these toxicants affect those. Next. This is from Peter Spencer's book on neurotoxicology, which just sort of diagrammatically shows what I've just mentioned. And anatomically, we have the dorsal root ganglion or sensory ganglion neuron, this being in the peripheral nervous system, which has a single axon, as I've mentioned earlier, which has a central or a peripheral branch. And the central ones may synapse locally with second-order sensory neurons. Secondly, there we have the motor system, which may have has the upper motor neuron in the cortex, a lower motor neuron, spinal cord, or brainstem. And coming from that, a branch which travels through the central nervous system into the peripheral nervous system. If we think of agents that are neuronopathic that affect the nerve cell, one of the example I'll use is doxorubicin, which affects the dorsal root ganglion neuron. And it does that because there is a diminished level of blood-nerve barrier in this region. And therefore, the drug can get into the dorsal root ganglion. It can't get into the central nervous system under normal conditions. And when it does this, it affects the nerve cell by mechanisms we'll talk about in a moment, produces severe damage to this, eventually necrosis of this cell. And of course, when the nerve cell goes, the axon, which is basically a process of the nerve cell, also degenerates. So that's one pattern of injury. Second one will affect the axon, and this may be in the distal portion of the axon. And sometimes, particularly with multiple doses, this tends to move back toward the cell body, hence the designation of dying back neuropathy. A little swelling here indicates the masses of neurofilaments that one sees with some of the hexacarbon toxicities, also with acrylamide, and then the little dots here indicate Wallerian degeneration, or degeneration of the fiber of the axon distal to that site of accumulation. And you can see this in the central nervous system and in the peripheral nervous system as well, and clearly in both, and both can be affected. Then there is the proximal axonopathy, IDPN is the model, which you get the same sort of neurofilamentous accumulations, but proximally rather than distally, and with subsequent atrophy and sometimes degeneration of the axon distal to that site. And then lastly, agents that can affect the myelin. And myelin injury is sort of interesting because not all internodes of myelin are affected. So you can see you have sort of a skip-type effect. And also, since the axon remains intact in primary myelinopathies, one could get remyelination, usually in the form of these smaller, shorter internodes of myelin, repair of the lesion, if you would. Okay, so We'll look now at the Doxorubicin neuronopathy. Again, this is much as it does as an anti-cancer drug, as it gets into the dorsal root ganglion. I should add that this is sort of species specific, so that rats are really the animal that shows this change. Quite strikingly, it's not a real feature of the human treatment of human cancers with this drug. One gets this intercalation between base pairs in the nerve cells, inhibition of RNA and thus protein synthesis, and produces sensory neuropathy, since this is a lesion that's restricted to the peripheral sensory ganglia. Next, please. I think we can skip this slide. In the rat model, again, we give 10 milligrams. These are single intravenous doses, and this takes some time to develop. So with 10 milligrams per kilogram, see within not quite 2 weeks, we begin to get clinical effects of hind limb ataxia. They have other lesions, other signs as well, but this is the most striking. And if we halve the dose, we increase the time prior to development of signs. Next. This is one of the rats. This is from a paper by Lucy Cho. This paper has some age on it, but it does show the sort of wide-based gait that the rat has with this Doxorubicin-induced neuropathy. Next, please. And I mentioned just this is a normal animal, spinal cord, spinal nerve roots, and this animal has been injected with Evans blue, which is a dye that complexes to albumin and will pass through the blood-brain barrier, and will not pass through the blood-brain barrier, but will pass through other capillary beds, and these animals will be stained blue, except in the central nervous system and retina. As we can see, that's spared. But the dorsal root ganglia, or the peripheral ganglia, do stain because of the diminished level of blood-nerve barrier in that region, which is a normal condition. And hence, the doxorubicin can enter the ganglia. And some of the lesions, just to show the evolution, initially we see regions of clearing in these. This is a dorsal root ganglion neuron. In the nucleus, you see these regions of clearing, which are thought to relate to the doxorubicin effect on the chromatin, the intercalation between base pairs. This cell is abnormal. It's got many dense bodies, probably associated with, related to degradation of organelles and autophagocytosis and breakdown. The nucleus is pushed peripherally. Next. Sometimes these cells can't maintain their osmotic environment and undergo swelling, and next, and then undergo necrosis and phagocytosis by macrophages. Clearly, when as these events occur, there is similar degradative changes within the full length of the axon. Next. As an example, this is let me just turn the lights down a bit. This is a cross-section of spinal nerve root, and this is the ventral root. Remember I said that this was doxorubicin primarily affected the dorsal or sensory root, and this is really a normal nerve root. It's been perfusion fixed, and you can see this is very low power, but you can see the axons with their thin myelin sheaths, and this is really an intact structure. On the other hand, from this particular segment, if we look at the dorsal root, next please. You could see that it's quite different. First of all, it's a tremendous amount of swelling of the root because of edema, and the edema is associated with degeneration, represented by these dark masses of the degenerated axon and myelin sheath as part of this process. And this can extend into the central nervous system branch of these sensory neurons. And is that focused? All right. Anyhow, it's thanks. These dark, you can see that this is the sensory tract, the fasciculus gracilis in the midbrain, in the medulla, showing the same sort of appearance, degenerating axons. So the basic lesion here is an injury to the nerve cell body itself, with degeneration, necrosis, and degeneration of the axon. Next, please. This is some material that's been lent to me by Tom Bolden from the University of North Carolina at Chapel Hill. And it does show another model of injury, neuronopathy, injury to the neuron. In this case, ricin which is a plant lectin, which has a ability to inhibit protein synthesis. And it has an interesting effect because you inject this substance into the nerve, and it's taken up in the nerve, carried to the nerve cell body by retrograde axonal transport following this intraneural injection. And since protein synthesis occurs in the cell body, that's where it has its effect, and it produces neuronal necrosis. And associated with the necrosis of the axon in the peripheral nerve produces an endoneurial edema. Next. Again, from Bolden's work, this shows where this is a schema of the leg of a rat, this hind leg of a rat. This is the sciatic complex. Actually, it's a little below the sciatic. This is the site of injection. The material is carried up to the dorsal root ganglia and lower motor neuron in the spinal cord, interferes with protein synthesis, and then subsequently gets degeneration of the axons that carried the material forward. Next, please. Cross-section of a normal sciatic nerve from these rats, showing the prominence of the myelinated fibers. The unmyelinated are not particularly evident here. Next. And this shows one in which there's been injection of the material, some degenerating fibers, but importantly, a separation, if you would, of the elements that are present. Some of these swollen axons are also degenerating. And there's also an edema, an increased separation of the axons. Next. And ultrastructurally, just to show some sequential changes in the affected axons. Again, we go back, this was a normal axon, such as this one is. Material was injected, it was picked up by the axon in some fashion, carried to the cell body, and then interfered with protein synthesis to produce necrosis of the cell body, and in this case, swelling, fragmentation of the axonal contents, and eventually, next please, collapse and actually degeneration of the axon. And really, this lesion, if you looked at it, would look identical to what you would see if you crushed the axon and looked at it distally below the crush. It really is a Wallerian degeneration, except since trauma is not involved, we use the term Wallerian-like. But actually, in fact, this is really more, because it's not only is the axon degenerating, but the whole cell is. Next, please. So those are two models, if you would, of injury to the neuron with resulting degeneration of all neuronal processes, including the axon. Now look at compounds that might affect the axon primarily, or manifest their effects in the axon, and we'll look at a couple that involve the most distal segment of the axon, the furthest away from the cell body. And one of these are the hexacarbons, and 2,5-hexane-dione is the most prominent of these. And these produce an abnormal cross-linking of neurofilaments, and they alter neurofilament transport. And what one sees then is distally you get axonal masses of abnormal masses of neurofilaments, these intermediate filaments of the axon, accumulate distally. There is a proximal axonal atrophy, again, because of some alteration in neurofilament transport. The neurofilament maintains the size, diameter of the axon. And distally, below these accumulations, you get a Wallerian-like degeneration, again, presumably related to some sort of starvation, if you would, of this distal segment of the axon. Next, please. This is this is sort of a schema of the model of that. It's a compound other than hexacarbons, but it shows the same sort of thing. That is the normal state, injection of the compounds. This is MNBK, but then to produce interference with axonal transport, accumulation of neurofilamentous masses, and this progresses, further enlargement of these masses, and eventually degeneration of the axon below the accumulation of the neurofilamentous masses. Again, all associated with interference or abnormalities of transport, and in the case of hexacarbon, with this abnormal cross-linking of neurofilaments. Next, please. Schematically, going back to the hexacarbon model, this is a node of Ranvier in a nerve fiber. This is proximal, so the cell body is up that way, and the synaptic ending is down this way. And usually in the distal segments, we get these massive swellings. Usually at the proximal end of the node of Ranvier, there seems to be something in the node that prevents the movement of these abnormal neurofilaments distally. So that it sort of gets this large plug within the axon. And as I say, distally to that, you will get degeneration of the fiber, and there is an associated interference with axonal transport in this model. Next, please. And some histologic features of this. This is the node. This is a longitudinally sectioned myelinated fiber, and you can see that this is rather swollen. This would be a more normal fiber in terms of size. This is strikingly swollen, and this may well be the same fiber that's sort of twisted out of the plane of section, or it may be another fiber. The swelling here, this pale staining mass of neurofilaments, is much more extensive, and actually the myelin sheath, which is present here, is actually sort of slipped off this portion. Cross-section of the same sort of lesion. All of these are normal myelinated fibers, and here's one that's just massively swollen, maybe 5 or 10 times as large as it was in the normal state. And what happens when that occurs is that you do get sort of a slippage of the myelin, and you get this large neurofilamentous mass. Next one, please. And ultrastructurally, same. Again, this pale staining area of neurofilaments in this swollen fiber. This is looks like a peripheral nerve fiber, but this can occur centrally or peripherally. Next one, please. And then distal to that, you get actually this Wallerian-like degeneration of axons distal to that lesion. So this is a distal lesion, and with appropriate dosage schemes, this material will progress back toward the cell body, and hence the name dying back neuropathy. The organophosphate are a similar group of compounds. And the exact mechanism of the organophosphorus ester-induced delayed neuropathy, or OPIDN, is unknown. It's thought to be associated, I guess people have recently said that it may be associated with some alteration of some aspect of rapid transport, not the rate, but the volume of material that can be carried. Some people have incriminated some form of retrograde transport interference. But basically, it's unclear exactly how this neuropathy develops. It is associated with the aging of an enzyme in the nerve cell, and actually seen in other tissues as well, of the neuropathy target esterase. And this enzyme, which doesn't seem to, we don't really know what this does, other than there is this association that following dosage with these organophosphates, you see a rapid inhibition and a change in the conformation of this molecule called aging. And if that's of a certain extent, this compound will produce the neuropathy. Other organophosphates don't produce this effect, and they don't produce the dying back, the delayed neuropathy. So not all organophosphates will produce this lesion. But a week or more after dosing, in the single dose, you get this distal neuropathy, which develops. Next. And the lesions are very much like the ones I've shown you with the hexacarbon neuropathy, except you don't see the large neurofilamentous swellings associated with these. But distally, you get degeneration, sort of Wallerian-like degeneration of the axon. And this affects the larger fibers, as indeed does the hexacarbon neuropathy. So the smaller ones are spared. The smaller myelinated fibers are spared. Next. And this is the effect in the central nervous system. Same sort of lesion. Next one, please. The last of the axonopathic compounds I'll talk about is the beta prime immunodipropionitrile, or IDPN, which no one ever uses the long name, the real name, I guess, neuropathy. And here the lesions are proximally, and they are thought to be associated with impaired anterior grade transport of neurofilaments. So something in terms of neurofilament transport, some people may feel there's an alteration of neurofilament production, but one gets these proximal masses of neurofilaments in the axon, sometimes in the cell body, and these may later migrate distally, but the primary effect is on the proximal axon, proximal portion of the axon, and this also leads to atrophy and degeneration distal to this mass of neurofilaments. Next. Again, an electron micrograph to show, again, a relatively normal axon, myelinated axon, and here are 3 proximal ones with this massive neurofilamentous aggregate. The primary lesion, if you would, of IDP and toxicity, and again I would emphasize this is proximal in contrast to the others, which primarily affect the distal segments. Next. Lastly, I'll talk about some of the myelinopathies, where toxin affects the myelin sheath. And just again to review, we had the cell body, the neuron, the cell body, the axon, which can be quite long, and the dendrites, and of course the myelin sheath is present on the axon of some fibers. Clearly not all, and indeed not the majority. In the peripheral nervous system, the myelin sheath is formed by the Schwann cell, and here's one that's sort of been unfolded to show the rather complex nature of it. And it does have regions of compacted plasma membrane, the myelin, and then there are Schmidt-Landerman clefts, sort of connections between the pericardial cytoplasm and the rest of the cytoplasm of the cell. And I'll show you how these are thought to enfold the myelin sheath, the axon. And then, of course, the oligodendrocyte, which has numerous processes which will form myelin at their end around into different axons. And there are some chemical differences, even though between central and peripheral myelin. Next, please. This is sort of a schema to show the development of the, in this case, the peripheral myelin sheath. The central is similar. We have the axon, and the Schwann cell sort of envelops the individual axon, and of course one segment of this axon. And where the signal is given for myelination, one gets this mesaxon. I'm not sure. Is my sound system? Yes. Surround the axon, concentric, multiple coils around the axon. And eventually the plasma membrane becomes compacted to form the myelin sheath. And again, this is one segment, and multiple segments or rich nodes of the myelin sheath on the axon. Next. We look at Triethyl. This is a central nervous system myelinopathic lesion, and it disrupts the acting myelin melee. Actually, it's thought to affect myelin basic protein. And this causes splits within the myelin sheath, so-called intramyelinic edema, vacuolation, separation of the myelin at the interperiod lines, and then eventually sloughing off and loss of this myelin, of these myelin sheaths. Very rapidly acting agent. Next, please. And this is a schema to show a lesion. In this case, cerebellum of a rat treated with Triethyl, showing this is the cerebellar granular layer. This is the cerebellar white matter, and normally this is a Luxol fast blue stain, and normally this would be sort of a dark blue staining material. You can see this marked vacuolation and separation of the myelin elements. One does not see the axons with this stain. Next, please. Electron micrograph to show the splits at the interperiod line. There's the sort of dense and myelin dense lines at the interperiod line. The splits occur there. And eventually these can be quite extensive in the central nervous system and eventually lead to loss of that segment of myelin. Next, please. We look at another model, in this case a peripheral myelinopathic agent, Tellurium. This is a rather interesting agent because this apparently has a growth-related effect. Tellurium is thought to block cholesterol synthesis. Cholesterol is a major component of myelin. In this case, it produces a peripheral neuropathy, Schwann cell injury, demyelination. Remember, the Schwann cell forms the myelin. Get demyelination, vasogenic endoneurial edema, sort of a non-specific effect, we think, and then remyelination. As I said, if you give these to older animals, you don't get any effect at all. If you give them to animals under 25 days of age, to rats under 25 days of age, you produce this lesion. Because this is a period of rapid growth. The model that's used is, I guess, from Tom Golden's lab. They use long-acting rats at 20 days of age. You put the tellurium powder in the food. The animals are on this compound for 7 days and then put on a regular diet, and then the sciatic nerve is sampled at various intervals. Next. And this just shows the scheme of what is thought to happen. These are hours on the diet. And initially one gets an inhibition of cholesterol synthesis in Schwann cells. There's an associated breakdown of the blood-nerve barrier. About 48 hours we get vacuolar degeneration of the Schwann cells, and then this progresses to demyelination. And if you look at the next slide, you see some of these lesions. This is the early vacuolar change of the Schwann cell, again, the axon, the myelin sheath, the Schwann cell. You get to see these vacuoles developing in the Schwann cell. Next. Here's the axon. It's relatively normal, it's a little squashed, admittedly, but the main change is sort of the fragmentation of the myelin sheath subsequent to the injury to the Schwann cell. And next. Looking at it, these are the light microscopic levels of the normal sciatic nerve, the myelinated fiber showing up as sort of these blue donuts. Next. And this is with the relatively early stage of breakdown. Some cells, you can see some myelin sheaths are breaking down. There is an edema or an increased separation of the elements here as well. Next. If you tease these fibers, you can see, and this is a good way to look at demyelinating disease, that is, you can tease individual peripheral nerve fibers. Here's a myelinated node that's relatively intact. Here's one that's fully demyelinated. Here's one that's undergoing demyelination. And this is obviously not consecutive. Another demyelinated one, one that's showing some demyelination. Here's an early stage of demyelination. That is a separation of the myelin, beginning at the node of Ranvier, which is roughly here. You can see the sort of pulling back, if you would, of the inner nodes of myelin under the influence of this toxicant. And eventually this will lead to a fully demyelinated inner node. Now, both structurally, this is the height of the lesion. We have, here's a relatively normally myelinated fiber. Myelin is sort of convoluted, so something may be happening here early on. Here's a fully demyelinated, this is the axon, which is relatively normal appearing, and then this is the myelin debris within either Schwann cell or macrophage. So this myelin has been degraded and phagocytized, leaving the axon unmyelinated. Similarly, here's another one that shows the same process. Now these will remyelinate. So in demyelinating disease, we classically think of the axons remaining intact. So in this case, once this growth-related or this age-related susceptibility is overcome, with tellurium, the myelin sheath, the axons will begin to remyelinate by Schwann cells. And the remyelinated segments usually have a much thinner myelin sheath relative to the normal, relative to this diameter of the axon. Sorry, can I go back to that? And of course, the remyelinated sheaths will form in much shorter segments, but largely repair can occur. So that's one of the differences between neuronopathies or some of the axonal degenerations and the demyelinating conditions. That is, the demyelination repair can occur quite readily. And so the characteristics of tellurium neuropathy would be the breakdown of the myelin sheath. I guess some degree of axonal degeneration, not very striking. Remember, the Schwann cells can either myelinate or non-myelinate, depending on the nature of the fiber they encompass. And the non-myelinated Schwann cells are unaffected, so it's the myelinating ones that are affected. And you get this monophase of demyelination, and you can get remyelination, even if the animals are kept on the compound, and they can recover completely. I think that's the next slide. So what I've done then is try to briefly